There is so much that happens to an injured patient within the first 60 minutes after injury, and it's called the golden hour. So having a trauma center close by is crucial. Trauma centers are ranked as a 1, 2, and 3 based on the resources and availability of certain specialties. Being designated as a level 3 trauma center, we provide basic trauma care and some advanced procedures, and we are fortunate enough to have neurosurgery at our facility, which is not standard for all level 3 trauma centers. Our closest next trauma facility is a level 1 trauma facility in Fresno. After that, Kern in Bakersfield, and then of course the Bay Area trauma centers. We have the helipad, which enables us to receive trauma patients who are in remote locations like Sierra Mountain Nevada range, as well as some of the other remote locations in the valley that don't have rapid access to roads. It also enables us to transport patients out of our facility should we not have the necessary resources to provide excellent care.
In our EMS system, as in most EMS systems in the United States, if patients meet trauma center criteria for EMS, they go to the nearest trauma center. Even if a patient is critical, they are going to bypass closer hospitals to get to a trauma center because patients will have better outcomes. Requirements to become a trauma center are much more stringent than it would be to provide other specialty services at a hospital. It is a huge commitment from a facility to be a trauma center. Financial commitment, the resource commitment. We have to have a lot of physician specialists. The nurses and doctors and staff have to go through extensive trauma training.
This verification by the American College of Surgeons signifies that we have met or exceeded the requirements set by the college to provide world-class care for the injured patient. It is not something that is required for all trauma centers, but we recognize that those standards are standards of excellence, and so we seek this verification and re-verification every time that we can.
It's not something that most hospitals can accomplish. I think it elevates care for all of our other patients, be it cardiac, be it stroke, because we have to maintain such a high level for our trauma program. It could be the most critically injured trauma patient, and it might be something as simple as you have a sprained ankle. Nonetheless, they're all trauma patients and treat them all the same. I couldn't ask for a better group of people to work with. They're all dedicated and we're all on the same page.